All right, so we have as our next speaker Dr. Richard Patel and his son Alex Patel. Richard Patel is a professor of psychiatry at University of California, San Francisco, UCSF. Alex is the instigator of the book PP's Anti-Joke Book and Brief History of Humor. His continued humor about challenging situations he found in high school was a trigger for collaborating with his father, Rick Patel, in exploring this topic and writing their first book. And they'll be talking about why humor is funny and good for you. Let's welcome Richard and his son Alex.
Thank you very much. I'm Dr. Richard Patel. I do work at UCSF and at the Department of Psychiatry at San Francisco General as well. And I'm very proud to be here with my son, Alex, who we've been doing this for a couple years, since he was about just starting high school. And he can brag since then and still that he has a bigger brain than I do. My neocortex has about 23 billion neurons. That's the wrinkly part of our brain. His has about 25 or 26 billion neurons. But size doesn't matter. That's right. Except maybe in humor, because what started happening in high school was he started coming home with these anti-jokes. I don't know if you guys have high schoolers at all, but they can be a little snide at times. And luckily, Alex was nice enough to crack jokes at me when he was asking me to get away from bugging him about homework and such. And that's sort of how the book came about.
I'd say high school is absolutely brutal. People are mean, gross, obnoxious, and they just make me uncomfortable. And so what I felt as the best response to all this uncomfortability is making antidotes, such as what's brown and sticky?
What?
A stick.
What's brown and sticky? A stick. Okay. Well, this is a pretty good time to describe what. See, you just got to laugh a bit. What is an anti-joke? How is that different than a regular joke?
I'm glad you asked.
All right.
Because an anti-joke is like any regular joke we have. But
Yeah, how about if you grab that one there? Can you grab that mic? Maybe we can. So an anti-joke.
So an anti-joke is like any regular joke, but with a punchline that is obvious, such as what is red and smells like blue paint? Red paint. Obvious. Or one of my other favorites, which is extremely harsh to create and kind of lower tension, such as why was the little boy sad? Because he had a frog stapled to his face.
Okay, that's harsh.
It's
That's
harsh.
It's
It's
harsh.
extreme.
That's an extreme anti-joke.
It loses tension. And one of my personal favorites. One more time? One more time. Thank you.
Speak it to the mic.
Okay. Why was the little boy sad?
Why?
Because he had a frog stapled to his face.
There you go. That would make any of us sad.
And one of my personal favorites, the nonsensical, or the jokes that make no sense at all, such as, why not swim on a full stomach?
Why?
Whose stomach?
There you go. So their anti-jokes are like regular jokes, but they have punchlines that are alternatives. They're either obvious, make no sense at all, or extremely harsh. So he was coming home with these jokes, and we started kind of looking into why they were funny. Because when you really think about humor, imagine this. You're an alien coming down from another planet, and all of a sudden somebody comes up to you and says, knock, knock. Who's there? Or come in, or whatever it might be. Humor doesn't seem to make a lot of sense when you look at it objectively, but we started doing some studying. We started looking into the origins of humor, what we thought was funny, and we wrote a book called PP's, what's that?
The best I've ever seen.
The best book ever. PP's Anti-Joke Book and a Brief History of Humor. Now, we've done this lecture, as I said, several times, and there are several things we cover in the book. There's lots of anti-jokes that are terrific. There's a narrative about our great-grandparent, PP. We only know his initials, but he did survive the Russian Revolution by the thin skin of his weird humor. And so we sort of track his travels and how, in a life is beautiful kind of way, I don't know if you guys know that movie, but was able to survive a lot of adversity by joking his way through. The one skill that our family tends to have. And the last part, which we're actually going to be emphasizing today, is a lot of scientific facts behind humor, the evolution of humor, and how it functions within our species and actually in other species as well. We don't have PP's Anti-Joke Book on the shelves yet. We're actually romancing New York agents right now, but we do have some promotional copies, and we can share it with you after the talk here today. A few years ago, Vivek Murthy, if I'm pronouncing that right, he was the youngest Surgeon General ever. He was under the Obama administration. And his primary objective during his time in office was to increase Americans' happiness. That sounds really good to me right now. He did this looking, don't you think? He did this by looking at 4 aspects. For some reason, I don't think right now we get that from the Surgeon General or this administration, but he emphasized it. They looked at a few different things. They looked at physical activity. They looked at meditation. Gratitude exercises were one of the things promoted, and social connectedness via such things as humor. Now, we all know, we just had a fantastic lecture regarding diet, but we all know that health maintenance takes a little bit more than that. It takes proper diet, it takes exercise, it takes being mindful, it takes stress reduction via such means as humor. Laughter has been shown in a lot of studies to reduce anxiety, cause people to be less depressed, cause glucose levels to stabilize, causes all kinds of things, which we're going to talk about, decreasing heart attacks. It supposedly makes us look younger, makes us more attractive to those that we're trying to attract.
So what you're saying is laughter can cure disease.
Kind of.
That's incredible.
Thank you.
But do you have any proof?
You know, I'm glad you asked, Alex. As a matter of fact, there's lots of proof out there, and we're going to go over some of this. He's great at this. We're going to go over some of the health benefits of laughter. In general, it seems to decrease stress. It helps us tolerate things that we're afraid of. It promotes socialization. It's been called grooming at a distance. We can see monkeys grooming each other. We groom each other by laughing with each other. It protects the heart. It boosts the immune system. It relieves burdens, inspires hopes, decreases pain. How does it do this? We're going to look into it. The answer is complicated, and humor, as well as the goal of humor, changes throughout our entire life. Now, in order to start this, I always think it's good to get everybody involved. I need some help. Natasha, run on down here, and could you guys distribute our props? We should have done this earlier. So if you could run around. Now, humor, as you know, doesn't just happen in a vacuum. You got to kind of get in the mood. So what we're going to do now, with the help of everybody, thank you. That is slapstick, which is a wonderful vehicle for humor. But here, let's distribute these. So I'm going to pass these out to people. I'm going to run up here. So take some nose and glasses. This is very important for you guys to understand. This is an experiential lecture. We're not just going to sit passively here. Here you guys have nose and glasses. I know every lecture does that, right? You get little prompts and stuff. You got some here. Pass them out. Yeah, help us out here. This is community. Okay. There you go. All right. Oh, you look great. Here you go. You guys didn't know you'd be involved in this, huh? But yeah, we're doing it. Grab good ones. All right. I'm going to save 2 because we got to have some too. You got those back there? I see a single nose if anybody has a... There you go. You got a couple more. Oh, I don't know that we have enough for anybody. Anybody just want a nose alone? Okay, well, we have a nose, and I'm going to set this right here. Here's an extra nose if somebody wants an extra nose. Anybody? Take a nose. There you go. Thank you. Okay. That didn't take too long. So now I'd like, let's go. Let's go on. I'd like to welcome everybody to our humor lab.
You've already done this. Thank you very much.
Yeah, good job. So I'd like everybody to put on your nose and glasses. This is an important part of this thing here. You guys look good. Somebody take a picture. I don't think the Silicon Valley Health Institute has ever had such a good crowd here. You got a camera? Here, I want to get in this. Hold on. There we go. There we go. All right, everybody say cheese. You guys?
Oh boy.
All right.
You bet I did.
Okay, good job. Good job.
Thank you.
I'm going to take this off because I'm going to take that. We'll clip this back on. I'll just hold this thing. All right, so you have entered what's called the comic space. So something different has happened. If you look at your neighbors, just kind of turn and look at your neighbors and say hi. Hi, there you go. See, there's some people laughing. There's something different going on here than before. Something that different occurs within us and something that is different has occurred within us as well as between us. And of course, like everything, there's names for this kind of stuff. I'll let everybody click your selfies and then we'll move on here. We've entered actually another world, and this world is called the comic space. Now, that is the fundamental mechanism of humor, is comic space. We need this comic space or comic distance because it allows us to laugh at things that we wouldn't really normally laugh at. But once I say like, hey, here's a good one, or whoa, you know that my intonation or whatever I'm leading in with is alerting you that what's going to come next is funny and not to be taken too seriously.
Hey, you want to hear a joke?
I want to hear a joke? Sure.
You want to hear a joke? What part of a tree scares a cat?
What?
The part falling on it.
There you go. Actually, that's a really good example because the setup was, hey, let me tell you a joke. So we're ready for a joke. We're prepared for something not very serious. What part of a tree scares a cat? We expect bark because that's a normal joke, but we do anti-jokes, so we kind of take it. The part falling on it. So at first we can think, oh my God, that's so horrific. A tree is falling on a cat. And if we've had a tree fall on a cat, maybe we wouldn't find that too funny because we're too close to it. But then we realize, wait, this is a joke. It's not funny. These are called comic devices. And nose and glasses is one comic device. Me saying, hey, do you want to hear a good one? That's another comic device.
What about repetition?
Repetition's a comic device.
What about overstatements?
Overstatements is a comic device.
Understatements?
Understatement's a comic device.
Repetition?
Yeah, I got
Puns?
it. Puns are good.
Slapstick?
Slapstick.
Repetition?
Repetition. Okay, thank you, Alex. Once you are in the comic space, and you're welcome to wear the glasses if you like or take them off. Whatever you'd like to do is fine with me. But once you're in the comic space, there are three things that happen. The first thing is, you're ready for humor. And you're ready for tension to be decreased because that's one of the primary mechanisms of comedy, laughter, and humor is that it releases tension. And classically, that is the definition of comedy. Dante Alighieri's Divine Commedia, where I'm probably pronouncing that Latin wrong, but where he goes into hell, comes back basically okay. That's considered comedy because there's tension and people come back all right. I take the standard joke. Horse enters the bar, and the bartender says, why the long face? Okay. So horse enters a bar. We can quickly suspend that that's a little weird, but okay, we live in a modern era of cartoons and all sorts of things, so we can accept that, and it's a joke. And then the bartender says, why the long face? There's a double entendre. It means, okay, the horse's face is long, but it's also a standard thing that you say to somebody who's upset. So what happens is there's a little tension that builds, and then you quickly rectify the double entendre in your mind, the tension's released, and you give a little giggle. Yes, I know humor is not funny when it's explained, but that's what we're doing a little bit here. Actually, there is an anti-joke that goes along with that too. It says, a horse enters a bar, and the bartender says, why the long face? And the bartender says, the horse says,
I forgot my daughter's birthday.
right, something like that. So anyway, you don't get the expected punchline, so there's another bit of tension that builds and releases. There's actually a worse joke that goes with that, so thank you for doing the nice version of it. The second punchline to humor is socialization and bonding. Right here we have an etching from 1733 that shows tiers of society laughing at a theater. What's interesting in this is they're really not looking at the theater at all. They're sort of laughing at each other and things like that. Socialization is very important in humor. We laugh about 30 times more when we're with people than when we're alone. And that's because laughter doesn't just convey, let's see if I can clip this on here, convey silly things that are happening with your mic. It doesn't just convey something is funny, it conveys that we understand what you're saying, it conveys that we agree, that we're part of the same group, that we like somebody or even love somebody. It's both a cognitive and an emotional display. Thank you. Now, in our research of humor, we found that there's lots of theories of humor. And not all of them are really associated with health. Socrates, Plato, the Bible, Thomas Aquinas all thought humor was not good because they were looking at it as a superiority. Oh, I make fun of you, which makes me better than you. And that kind of humor is not really what we're talking about today. We're not talking about laughing at people. We're talking about laughing with people. One of the things that we did discover, though, by going through all these different theories, and there's a couple dozen of them, is there seems to be a quality where it promotes learning and understanding. We start to understand edgy ideas through what? Comedy shows, through comics, sitcoms. We see people portrayed, and as you go through the kind of the history of the comedies on television, for example, you see edgier and edgier material being introduced, not only to make us laugh, but a little bit of that is to make it okay. Now, I'm not saying that all ideas that comics are going to joke about are something that you're going to accept, but it's certainly something where you can consider it for a moment in a safe space, in that comic space. So we really like sort of a cognitive theory of comedy that it also promotes understanding and learning. We're not going to talk too much about humor history. We've done other lectures where we do this primarily, but it's enough to say that humor's been around as much as we've been human, maybe even a little before. The oldest Egyptian hieroglyphs from about 2500 BC show people laughing at fools and jugglers, and the oldest known joke is from the ancient Sumerians around 1900 BC.
Do you mind if I take this joke?
You want to go for the joke? Go
Thank
for
you
the
very much.
joke.
Something which has never been since the beginning of time, a young woman that did not fart on her husband's lap.
Now again, maybe you had to be there. One of the things that's interesting about when you look at jokes from a long time ago and you look at our own personal development of humor, you actually see ontogeny recapitulates phylogeny, which basically means that the evolutionary development kind of matches our own personal development. So the first jokes back in ancient history had to do with poo-poo and pee-pee and genitals and people slipping and falling. And when you look at things that make little kids laugh, it's poo-poo and pee-pee and hide-and-go-seek and these things too. And as we developed as a society as well as individuals, it seems to get more and more complicated. You know, what's kind of interesting is to get to the point that we're going to make here about the health benefits of humor, you have to understand a little bit about where humor came from and why we laugh at all. V.S. Ramachandran, he's a famous neurologist. I think he's down in San Diego. And a lot of evolutionary biologists have felt that humor is such a primary human function that it's actually an instinct. And which I think it's probably true, because if you look at deaf babies know how to laugh even if they've never heard laughter. Blind babies know how to smile even if they've never seen anybody smiling. And these expressions seem to be the same in every culture and all around the world. As I said, I think humor's been around even before we were human. And if you scratch horses in a certain way, they can be tickled. As a matter of fact, just kind of going across the mammals, all mammals can be tickled. That's a fun fact. Rats tickle, but it's at a pitch that's so high the human ears can't hear it. All primates certainly can be tickled, and they even appreciate humor, or at least, and they certainly laugh. In primates, this is where we start to get a clue as to the modern function of humor. It seems that primates use it as a retraction of a cry for help. Or let me give you an example. So I was down in Corcovado. I don't know if you know where that is, but it's a rainforest preserve down in southern Costa Rica and Central America. And they have capuchin monkeys, squirrel monkeys, and there was this troop of howler monkeys that kind of went past the little eco place where I was staying. And I knew where they'd be, so I was kind of creeping up to them in my amateur kind of trekking way. And they didn't spot me, but they heard something going on, and all of a sudden they froze, because they don't know if I'm a jaguar, they don't know what I am. And once I sort of presented myself in my Bermuda shorts and flowery Hawaiian shirt, the lead one started going hoot, 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 hoot. And then pretty soon the rest of them did hoot, hoot, hoot. And you could see them relax, then they went along the canopy on their trip. So that is what the modern theorists believe is the origin of laughter. It's a tension-releasing retraction of a cry for help. They've done studies looking at this, and this is what I love. Wouldn't you love to get a grant like this? Marina Davell Ross over at Portsmouth University in Great Britain, she got a grant to tickle all types of primates, which I think is so funny. So millions of dollars spent on this, of tickling humans and tickling primates and capuchins and howler monkeys. And what she found is that closer evolutionarily that the species is to us, the more the laughter sounds like our laughter. So chimps and bonobos who are pretty close to us, the laughter sounded a lot like us. Like, I'm not going to even try. But when you get to little squirrel monkeys and the capuchins, it's more like little clicks, and gorillas even have more of a click. They don't have the big thing like the howler monkeys have. Again, it all looks like this is something that's been developed long ago. And all primates, including all mammals, exhibit some sort of laughter, and even some of them, besides humans, crack jokes.
Do you remember the story of Coco?
Go.
For those of you who don't know, Coco is a 42-year-old gorilla with an IQ of roughly 70 who lives in the Santa Cruz Mountains. With her keepers, she has been able to...
Hold the mic on your mouth.
There you go.
Thank you. Thank you. With the help of her trainers, Coco has been able to learn over 1,000 American Sign Language symbols, or the gorilla equivalent of, as well as 2,000 words. But she was noted once slyly knotting her keeper's shoelaces together, running in front of him, and then signing "Chase me," so he would fall.
Which is great, you know. Come on, she sneaks the shoelaces together, runs in front, says, "Chase me." Oh, come on, that's slapstick. That's beautiful. So yes, it has been shown that animals will crack jokes, and I think anybody who has pets probably have assumed this for a long time. You know, I mentioned tickling before. Oh, well, do I? Yeah, we don't. How much time do we have? Yeah, we're doing okay. Let's go back a slide real quick. This one basically just shows that they've done studies looking at the expressions, not supposed to go too close, expressions of humor in humans and primates, and they look very similar. And interestingly, in this study, they were giving the chimpanzees a reward for something, and I don't remember the details of what the task was, but they found that the chimps would realize that they did it correctly even before getting the reward because they were looking at the smile on the trainer's face. So theorizing that they could recognize that as a positive reinforcing kind of thing and realize that they did the task right. I mentioned tickling earlier. There's a couple theories to tickling. Sure, who wants to talk about it? So tickling, it really is two different things. One, it facilitates a bond between the parent and the child, and everybody loves tickling babies. They laugh and we crack up, and it just becomes this great bonding social interaction. The cynics of the 19th century, when those people were thinking way too much, however, came up with another idea of what tickling's about. And I wouldn't have guessed this, but they thought it was practice for combat. Because if you think about what happens, especially with siblings, you know, they're on the ground, they're tickling, ow, stop it, do it some more, stop it. And the tickling zones are really in very vulnerable places on our body. So that was one sort of theory about tickling. I like the idea of bonding a little bit better than the combat idea. Of note, you know, tickling is a different pathway, but here's the couple common pathways in the brain for humor. When somebody says a joke or somebody has a slapstick, they fall on a banana peel or whatever. The blue little thing there, it says real, but that is involuntary laughter. That's the kind of laughter where you are falling on the ground, you can barely breathe, it's out of your control. That seems to be more primitive. That might be the howler monkeys going, because it's in the midbrain and pons and midbrain areas. It's not really comes up in the frontal lobe. The other, the posed laughter, is what they call the voluntary laughter, and that has to do with a lot of social communication. As we know, humor can communicate a lot of things. I could walk in and somebody say, ha ha ha, the boss looks pretty angry today, or ha ha ha, what kind of nice weather we're having. Humor communicates lots of social cues beyond just, oh, something's funny. And this is where we get the prefrontal cortex and the more social parts of our brain involved in humor and laughter. Speaking about defensiveness with humor, you know, there has been people who have actually prescribed humor to patients. Not a bad idea in some cases. As early as the 13th century, a surgeon prescribed humor as a post-operative pain control mechanism. Not a bad idea. That's something that's even carried on to today. Freud proposed it as a defense, as you guys may know, saying that that's sort of a mature way to cope with information that's very difficult for us to handle, is to joke about it. We're not denying it necessarily, but we're putting it in a space that seems to be a little bit more safe. More modern humor is being used as medicine started probably with Norman Cousins, and maybe you know about this gentleman. He wrote for the Saturday Evening Post, and he became a little bit more famous when he described in a book that he wrote about 10 years after this, but he described his trouble dealing with ankylosing spondylitis. It's an autoimmune disease against collagen that can be extraordinarily painful, and he was having a lot of trouble sleeping. So literally, he locked himself in a hotel room, got lots of comedy books, comedy movies on, and sat there and made himself laugh. And he found that with a couple minutes of just really big belly laughs, it would allow him several hours of sleep. And he was able to make it through some of these bouts by doing this. Because he was so struck by this, and he'd never read about this before, he went to UCLA and wrote something called The Anatomy of Illness, where he really espoused the use of humor in helping people get through difficult times. There was a doc really close by here back in the 60s and 70s, a William Fry, who was a cardiologist who got the very first grant for studying humor in regards to the blood flow and oxygenation to the heart in heart patients. And he felt like about 10 minutes of laughter was really good for cardiovascular health. In the 70s, people probably know about Patch Adams. He was that doctor who was really inspiring people to kind of get through their terminal and chronic illnesses or other kinds of illnesses by using laughter as a major tool. He founded some place called the Gesundheit Institute.
Bless you.
Thank you. Where laughter became part of the routine of treating folks. 80s, 90s, laughter clubs started. Laughter, kind of forced yoga laughter where people are made to laugh, and pretty soon that turns contagious and turns into regular laughter, and that seemed to espouse a helpful effect as well. Oh, here we are. Good job on the slides. Okay, so what does humor do? So we know a little bit how it evolved. We know it has to do with decreasing stress levels. It has to do with socialization. It has to do with learning. So how can we apply this to health? Well, there's been a ton of studies out there, and I'm going to summarize them in just a couple different areas. These are the main areas that humor has been studied to help folks. Stress, I mean, I think everybody can understand that. If you've had a bad day, turn on the TV, listen to some comedy, and that can really lower the stress. And if you measure the stress hormones, epinephrine, norepinephrine, cortisol, growth hormone, all of those precipitously drop when people are laughing, which can have a lot of wonderful benefits. One of the benefits, and I think we all know that the immune system is affected very adversely by stress. If somebody's under stress, you can get your T cells, your B cells, your cellular, your humoral immunity. Humoral immunity, that's interesting. Didn't you ever make that connection before? All of those are worse. And people have done actual studies at this. They looked at folks that were in school. As you know, a lot of kids get colds. That's just part of the deal when you're raising a kid who's young, is you're going to get colds too. One of the studies they looked at was the immunoglobulin A's that are produced by the mucosal area. And so they first kind of swabbed this and found that if you're laughing for a few minutes, you actually increase the amount of immunoglobulins in your mouth. And that fights against flus, fights against colds, and they went further and looked at school children who were prone to laughing and school children that were not prone to laughing. And sure enough, and again, this is maybe a stretch, but they found that those kids that were laughing more got sick less. Now, there may be lots of reasons for this, but I have to tie it a little bit to the immunoglobulins because, in fact, when you measure the immunoglobulins, they're higher when you laugh. Looking at the immune system became very important in the 1980s when the HIV epidemic was raging with no real end in sight. And people had a lot of reason to utilize humor to help to cope with all the loss that was going on. Some researchers were looking at what's called, back then it was called natural killer cells. Now they're called non-B, non-T lymphocytes or null cells. And they found that these were improved in people that integrated humor into their daily regime of treatment. Those cells help Epstein-Barr, a lot of viral infections, and seem to be beneficial, hopefully, with folks. The other area in which the immune system's been studied with humor is in cancer patients. And again, I could go through lots of studies saying that it improves the immune system. But one thing that I know for sure is that when you interview folks that have gone through cancer treatments, they say that they've integrated laughter. About 50% of them have made a conscious effort to integrate humor into their treatment because it just helped them cope. With nothing else, it's the chemotherapy and all that implies. Now about 25% of cancer support groups formally integrate laughter as part of their treatment of patients. Very first treatment that was used, or that humor was used for, was for pain. And that's still used today. And they've done a lot of studies. Of course, we usually use college students for this stuff. They sat a bunch of college students in front of Friends or South Park or stand-up comics, Ellen DeGeneres and Eddie Izzard and different people like that. And then they got a bunch of other students in front of natural geology programs and things that maybe weren't quite so delightful. And they found that, and of course, after that, what they do, they zapped them with electrical charges that were painful, because that's what we do in these research studies with those college patients. And they found that people who were watching the comedy programs could tolerate the pain longer and greater intensity than the folks watching natural geology stuff and maybe things that weren't as interesting.
And
Sure.
Regarding that study, the three main explanations for this decrease in pain are that humor does distract people from this pain, as mentioned by Norman Cousins and his need to watch tedious amounts of humor shows, which is absolutely wonderful, as well as humor's ability to lower tension, which in itself then relieves stress, which, how can that be any better? And once again, my favorites, humor releases endorphins, and laughter, along that same line, laughter releases these endorphins, and these natural painkillers are extremely important in a time like this.
Yeah, especially when you're in pain. So yeah, we're not really sure what the causes of this. We know it works, whether it's just distracting yourself from the pain, whether you're lowering stress, because if you're under stress, you're going to be in more pain, or whether it's the endorphins that are released when you're laughing. Either way, whatever. It certainly seems to decrease pain. The other area that's been studied a great deal is cardiovascular health. So I mentioned Dr. William Fry here at Stanford. He was one of the first that got public funding for studying humor. And he found that about 1 minute of belly aching laughter, are you ready for this, is the equivalent to 10 minutes of rowing for cardiovascular health. Now, I don't know if you've ever been on a rowing machine before, but that's hard. Now, this isn't the kind of giggly laughter. This is, you're really laughing kind of laughter. But that's pretty good. I don't advise anybody to quit their gym memberships because of that. But another doctor, Dr. Michael Miller, actually said that the same kind of thing. He said, look, you won't get the pain or the gym costs, but I wouldn't replace the gym with laughter. But he says about 15 minutes of vigorous laughter was good for his patients that have had heart attacks. Who knows? But it certainly has been proven in multiple research trials that it increases the amount of oxygenation that you get. The last thing that I want to talk about here in regards to humor and health is, I'm a psychiatrist, a neurologist. I work at UCSF, so this is something that's really near and dear to me. And I'm going to complain a second. I know you're not supposed to complain during a humor lecture. But within psychiatry in the mental health field, we have the DSM. And people probably know what that's about. It's the Diagnostic and Statistical Manual that gives a sort of menu list to make a diagnosis. So if you have this and this and this, you're depressed. And if you have this and this and this, you have schizophrenia. If you have this and this and this, you have obsessive compulsive disorder. It doesn't at all look at the neuropathology that's going on. It just looks at symptoms. So what researchers have done within the field of mental health is they've developed this research domain criteria that really looks at the nitty-gritty of what's going on within mental illness. And they found that the major mental illnesses really have about 7 qualities in common. Now, they might be distributed differently within the brain, but this is really what we're talking about when we talk about depression or any of these things. And I'll relate this to what we're talking about. Bear with me. So white matter pathology, just to briefly go through this, I know it's getting later. Myelin is lost in a lot of the nervous system, which means that insulation that goes around the nerves gets less, and there's a lot of disruption and crosstalk. Messages aren't translated as well with demyelinization. You also get neuroinflammation. Now, we know inflammation's a good thing. If you hurt yourself, it swells up, gets all the good stuff there to fix it, and then theoretically the inflammation goes away. Unfortunately, inflammation often within the brain can release a lot of free radicals and cause a lot of problems more than it does good. Mitochondrial dysfunction, this has to do with also releasing free radicals. We need mitochondria, of course. They're little power plants within our cells. But within mental illness, there's a number of dysfunctions that causes them to misfire in a way that releases more free radicals. Glutamate pathway abnormalities, gene-environment interaction, shortened telomeres. This is kind of cool. So our chromosomes can't really live forever. I mean, we have this idea that they sort of divide and make other cells, but actually each time a cell divides, it shortens the telomere. It shortens the end caps on these until eventually aging and reproduction of these cells, they don't work anymore. So they're not infinite replicating machines. Turns out stress causes these things to shorten quicker, which makes the DNA not functional to reproduce the way it's supposed to, or to develop the proteins and RNAs, all that kind of stuff. And of course, elevated cortisol levels, which is pretty directly related to stress. Without going through too much detail, a lot of these are improved if the patient is calmer, if the patient is more relaxed. And so just by an assumption, you can imagine if people's stress levels are lower, about 4 of the 7 here aren't going to be as affected. There's obvious ones, humor improves group bonding. I don't know if any of you have ever worked in the mental health field, but students will often ask me, well, how do I predict that somebody's going to kill themselves? I work in the psych ER at the General. I see people every day coming in there. I was there 12 hours a day, so today, so bear with me if I flub my words. But so that when I tell the students this, it's not really a list. If you're sitting with somebody and they're crying, that's okay. That's good. Or if they're angry, that's okay. It's when you're sitting with them and there's no connection. They have checked out. A lot of things associated with severe with suicidality have to do with that. Severe medical problems, isolation, death of a spouse, divorce, all these things equal up to a higher percentage of people who end up committing suicide. And if there's a way to cross that boundary, to actually connect with these people, you really lower the incidence of suicide. And humor does that. The other thing that humor can do is it helps people cross the road. No, it helps people who are grieving. And I have my own personal example of this. As I mentioned before, we come from a family of goofy people who use humor to make our way through life. And my father was the same way. He always cracked stupid jokes, but you know, they were him. So when he passed away, what we did is we collected all of his little jokes that he wrote down, and we put them in strips of paper and we put them in an urn. Well, okay, we had two urns. One was him and one was his jokes. And so when we came up to the podium to kind of talk about the memories we had of him, we'd take out one of his jokes, we'd read it, and then we'd tell our remembrances. And by the end of it, we were just busting up. It was fun. And it's weird to say that about your father's funeral, but it was just such an enlivening, bonding experience. I walked out of there. Now, he was involved in theater, and so they were able to reserve a community theater to have his service in. And so when I walked out, I was walking towards my car, and there was a little park, and there was a couple sitting on this bench, and they were smiling at me as I was approaching. And I was like, okay. And they said, oh, that seemed to be what was the show you were seeing? And I said, oh, no, that was my father's funeral. And they didn't believe me, and they said, oh my God, that must have been a great show. And I said, you know, it was. And this was great too. So thank you very much for your attention. I think we have a few moments for questions if you have questions regarding humor in medicine, and thank you all.
Okay, any questions? Going once.
I know, we answered all of them. We were
Yep.
so thorough.
Okay.
Might be a bit of a stretch. I've learned about something in schools that's used called restorative justice to help bring down tension, get that connectedness you were talking about. And I just did a lot of research on that as well and wrote about it, but humor never came up. And I thought that would be fabulous to incorporate an element in the facet of student well-being. They have their own humor and so forth, but it's the ones who are disconnected, who have all the trigger points out there we don't connect. And humor would just start to poke holes in that tension.
I love that idea. You know, humor is one of those things that can certainly cross gaps. You can talk about racism, you can talk about Hitler's, you can talk about all kinds of terrible things, and be able to communicate ideas that are sometimes a little edgy. And humor is able to break, just like you're saying, break those barriers to be able to realize, wait, am I actually racist? Wait a second, am I actually, you know, you start realizing things about yourself and the world around you that you wouldn't otherwise entertain or accept. And I know, talking with Alex and experiencing his high school adventure, they use a lot of humor because, I don't know if you know this, but high school's a really awkward time. Things are developing, there's social pressures, all kinds of stuff. And Alex has become a master at coping with things because of his humor. So that's a great observation.
By the way, Rich, if we got two mics, if Alex has an answer, just
Yeah, you can.
go ahead and put your mic up to him.
Okay.
All right. If there's an answer that he has, there you go. Thanks.
What's an easy way I can get 5 or 10 minutes of laughter into my life and my family's life a day?
Get the very first slide up here. Oh, go ahead. I know what he's going to say. Buy our book. That's what he's going to say. but one of the things that's actually very clever. Let's see if we can click on this again. Can we start this little thing that we had before? So on the web, there's something called the Skype laughter chain. As I mentioned, laughter is extraordinarily contagious. And so one thing that you can do, even by... Isn't that weird? I mean, to me, that's really weird. You see somebody... Exactly. It's like yawning. I don't pretend to, I mean, I get it because it's a function. I'm a howler monkey. I want to communicate to my troop that I want to communicate to my troop as a howler monkey that there's nothing to be afraid of. So I go, hoo, 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 and the one next to me goes, hoo, 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 and it goes through the whole troop, and we feel better because the tension is released and the endorphins are released. And so sometimes we can just watch babies laugh, and it's so contagious that's how you can do it. Now, Norman Cousins, he actually did put a lot of effort into this. He found things that always made him laugh, whether it's something that he read, comics, or movies. And again, he was very motivated. He was in a lot of pain, and nothing he was utilizing was helping his pain. So there's something on the web. You can search Skype laughter chain, and you'll just get videos of babies and people laughing, and that'll crack most people up.
There's also Comedy Icons Radio on Pandora. That's great.
Yeah.
Very good.
And so what about that fad that went around for a while where people had laughing groups? Is that still happening? I mean, seems like it's a good idea.
It's a great idea. You know, it's happening more poignant. It used to be in the 70s and 80s, you could go to the park and there'd be yoga groups that are forcing laughter. And people did actually a lot of studies on those too. One person, a yoga instructor, I don't remember her name, but she actually looked at patients undergoing transplant and to see if those under the laughter groups did better than those without. And those with the laughter groups had a less rejection of their transplant than those. Mechanism, I have no idea, but that was the study. They're around, but they're often in groups that are involved in people that are grieving. As I said, cancer support groups. It isn't as easy to go out and find a laughing yoga studio as it used to be, but they're around in certain areas. Might be something to start.
I think one thing also that's lacking is people forget how to play, because play also generates a huge amount of laughter when it's done right. And I know I work for a large tech firm, and there's very little play. And
Yeah.
I mean, to the point where I've actually thought, maybe I can convince them to let me be the director of play.
That would be
for the company,
great.
director of play and humor.
One of the things that I
Get
noticed.
people de-stressed.
Yeah, one of the things I noticed, now as I mentioned, I work in the emergency department, I work in the psychiatric emergency department, and all day long, some of the worst tragedies that you couldn't even imagine are walking through the door. And so we go out there, we're serious, we're trying to be very compassionate, and then we walk back and we just act goofy. And we make jokes to each other, and I have to let the students know that this is the way we recharge our compassion batteries, so that they don't think we're doing sort of gallows humor or laughing at people in a superior manner. We want to let people know that these type of jobs, and almost every job in tech is stressful also, these type of jobs, you need to do something to kind of get your compassion back, because if you do work like that all day long being serious, that's trouble. You take on that tension. So I know within places you probably wouldn't guess, within the ER or the psych ER, we go in the back and we'll laugh for a second with each other, because we got to let off that tension and recharge ourselves to come back. And I'm sure that's true in a lot of professions. But unfortunately, sometimes people don't realize the value of that. They don't put after work community stuff, or even during work sort of fun things to do. Some tech companies do, but I don't think as much as when they were first starting up. That's a really good point. And people will be much more effective, because all day long, work faster, more and more. It stresses you out. So to have a few minutes of laughter, you can kind of get back in there and do the job you're supposed to do. So I like the director of play, director of humor and laughter. I think that's a neat one.
Okay, any other questions?
A new career path, exactly.
This question is directed to Alex. I just would like to ask if you had an experience on how to stop bullies in school. Were you able to use your anti-jokes or your good sense of humor to stop the bullies?
It's my own opinion. It's just, for me, the best way I was able to endure it is acceptance. But it's more so that, like, you are who you are, so it doesn't really matter what people are going to say to you. And that, like, with anti-humor, for example, like one of my favorite things to say when people are like, "Oh yeah, you're short," I'm like, "Oh yeah, I may be short, but at least I'm still small."
Might be short, but.
It doesn't mean anything to me, but it removes kind of the hostility of their joke and kind of how they want their I don't know, aggression to impact you. It kind of removes tension, like I said.
It
disarms
them.
Distracts
Yeah.
from pain.
Or confuses them so you can run away, I guess, one of the two. Yeah, I think, bullies are usually having a lot of problems of their own. And they're probably undergoing a lot of tension too for whatever reason. Maybe they're bullied in their home. So if you're able to release that tension with a joke, it couldn't hurt. Buy her book. That's the way to do it. Buy her book.
All right, let's thank Richard and Alex.
Thank you so much.